A very good afternoon and a very warm welcome to one and all present here, the dignitaries on the dais, the faculty members, and my dear colleagues. Welcome to the first National Stroke Week, which is being conducted by the Department of Neurology at All India Institute of Medical Sciences, New Delhi. And we have gathered here to celebrate World Stroke Day 2021. To commemorate the same, we've been conducting week-long stroke awareness programs, and today is the third day of the same. And in this, we plan to unveil national stroke programs which are likely to have far-reaching consequences. Before we delve into that, I would like to welcome our dignitaries on the dais. I would like to call upon Dr. Aush to please welcome our director, Professor Randeep Guleria, sir. Ms. Sakshi to please welcome the director of IIT New Delhi, Dr. Gopal Rao. And Ms. Megha to welcome our beloved head of department and chief neurosciences center, Professor M V Padma. Now, to set the ball rolling, I'd like to call upon ma'am to please come and introduce.
Good afternoon, Honorable Director, Professor Randeep Guleria, the Honorable Director of IIT Delhi, Professor Gopal Rao, my senior colleagues, friends, and the little children who are also here, part of the research, my good friend Aarti. So, well, the theme of the World Stroke Day this year is time saves lives and every minute counts. And keeping with this, we thought that let's do the stroke week. The first time we thought, and instead of doing this, the usual public awareness lecture once on 29th of October. And the mandate has been that, yes, for time saving lives or every minute to count, it starts off with, being aware that there is something called a stroke happening. And the stroke statistics as they stand today are gargantuan in numbers, truly humongous. Now, as we speak, the published figures is that there's 20 seconds there's a stroke happening in India, and every 2 minutes somebody's dying with it. I mean, they're truly, truly humongous. And just last year's facts of 1.8 million strokes and 25% have happened less than 40 years of age, 35 years, 30, 25 years of age. It's no longer a disease which is an ailment of 60, 70, 80, 90, who's, actually, you should never say that ever, that has been a loss, but then it's not going to have that kind of a societal impact and that kind of a burden as against someone who's 30, 35 and who's only earning member, and I don't have to explain. That said, so we said, let's start with the awareness thing. So the awareness, this time we thought, let's catch the young minds. Catch those brilliant, and I really believe that the younger generation is much, much smarter than the older ones, and probably we are smarter than our older ones. I don't know, that's what I do believe then. So the young ones, and we gave the theme that how do I make my country stroke-free? And it was an amazing response of 54 essays which rolled in from topmost the schools in Delhi, which includes DPS, Mothers, Modern School. And we found the winners. And we had our Honorable Director on the 25th. We had the announcement of the winners, and they're going to get through his hand, and I'm sure this is a surprise to him. So you will be giving the prizes and the certificates to the winners tomorrow in the JLN auditorium. And probably there would be those essays we're going to send to the World Stroke Organization. I'd spoken with the president, and he said, please send them to Geneva. So the inputs they gave were amazing, and something which I thought our policymakers should know. And apart from that, of course, we also had an update on the nursing part, which is really neglected. And the stroke management is a teamwork. It's never one person. And it's, it is mandatory that the team gets to know, and it is mandatory that a stroke unit care makes a difference, and that knowledge needs to percolate down. So we had that yesterday, and again, a beautiful response thanks to our nursing officers. And that said, while people are getting aware, while people present in the required time window to us, the onus is on us as they come to the emergency. Our machinery should be well oiled, that no minute is lost in managing that patient. So that includes emergency. That includes emergency personnel, everybody there out there in the casualty. And of course, the rest of it has to roll in, the radiology, the entire team. How do we ensure that? Does it mean that 3,000 neurologists will take care of 1.3 billion population in India? That's a no-brainer. The second is that when we are saying every minute counts, strokes are not happening around AIIMS. In fact, there's a difference between AIIMS and Safdarjung. I'm not getting into it. Controversial. And they're not just happening in the big tertiary care centers in the urban world. They're happening in Timbuktu, where the nearest hospital will be just a district hospital. So if there is a golden hour for trauma, if there are golden hours for a heart attack, if there is this golden hour concept, and it is emergency physician, irrespective of whether it's an orthopedician, is an ENT surgeon, is an obstetrician, or a physician who's manning the emergency in a district hospital, he should be well-versed to manage a stroke. It's not that the stroke patient goes there and then he's referred for somewhere else. You have a brain attack, please go. Minutes are lost. So keeping that in mind, there are two huge verticals that were developed. One, which, though it was a concept, but the entire thing has been done by my young colleague, Dr. Vishnu, of developing a stroke app and empowering the district hospital level physicians to be able to manage that acute stroke, not referring to a bigger hospital. And this has been rolled out in a project mode, and again supported by the funding agency. The prime funding agency has been ICMR, and heartfelt gratitude to ICMR for that. And that is something which is going to get launched, and that Dr. Vishnu will be enumerating in a little elaborate way after this. And then we had a second vertical where we have multitude of medical colleges, educational programs, and the education at the level of medical students to those who are interns, to physicians, to nurses. And we know that the stroke unit care, though it's not as glamorous as going and dissolving a clot and doing this plumbing job, putting in a wire, doing mechanical thrombectomy, there's a mission thrombectomy, very glamorous, very expensive. But beyond that, it's a stroke unit care which makes the cut, which actually by itself can improve a stroke outcome by 40%, and this is published literature. What you need is a uniform, comprehensive, optimal stroke care module, and that's been developed by my friend and colleague, Professor Rohit Bhatia. I mean, someone I feel that if I have a stroke, I will go to. So he's developed this module, and this is again being funded by ICMR, and that's another vertical which is being launched today. Both these verticals are across the entire country, spanning 22 the district hospitals and 22 medical colleges across the north, west, east, and south of India. And if this rollout proves beneficial, then we hope that we will be able to give the evidence for a policy rollout so that it can make. So these are something which can then be a low-hanging fruit for the healthcare delivery system of any developing world where India as a prototype can take up and make a difference to stroke care in the country. And that's the need of the hour. Looking at the humongous stroke burden and looking at the theme that every minute counts. And the last and the not least, wherein we have the august presence of the director of IIT Delhi here, is the PET project, which has been, actually the seed of this was because of Dr. Amit Mahendratta, the faculty of Biomedical Engineering Department of IIT Delhi, wherein it started off with getting an assistive device which is low cost, India-centric, and which can make a difference. The most important part of a human body, one of the most important parts, is your hand function. So while we are saying that, we can prevent strokes, we can treat strokes, disability is a reality and it's here to stay. So what do we do with disabled stroke patients who can't reach you, who reach you but still are disabled? We tell them, do physiotherapy, and I'm sure my friend Professor Sanjay Wadhwa will disapprove of that statement. It is never simple exercise regime, isn't it, Rajiv? Now that's a comprehensive, holistic, integral, mandatory component to make someone go back into society, integrate into society as a useful member. And that's not simple. Vyayam karo, exercise karo. But that's the way the world looks at it. That's a science by itself. And in that assistive devices, where has the world reached? You have artificial limbs, which don't look like limbs. You have that equipment where they can run a marathon without having a limb. And where are we? Yes, we have robotic exoskeletons, which cost 1.6 crores. You can make them walk. But is that applicable? So my stroke care has to be approachable, affordable, accessible, available to everyone, all the citizens of my country, irrespective of the social, economic, geographic barriers. Isn't that the mandate of everybody? Isn't it? And as healthcare personnel, that's in our hearts and we need to work towards it. In that direction, the assistive devices have been developed, and ICMR again has funded the center. It's an excellence, the center of excellence to develop these assistive devices. And so IIT Delhi is integrally there. And thanks to Professor Ram Gopal Rao, who has really helped develop this. We already have a prototype which has been designed, and it has been a life's mission and passion of this little girl here, Dr. Neha, who's got her PhD on getting that. That is there. It is the prototype. It doesn't look like much, but just see a finished product. Maybe in a year or so, Neha, she'll be the richest girl around us here. So you have this thing, and similar to that, Professor Senthil is going to design a glove which has sensors, and I'm sure he will later develop something where by mere thought I should be able to move my hand. That's where the world is going to. So that is the mandate of getting the assistive devices which are low cost, and there's been a real headway, and the next 5 years we're going to get further headway. That's another vertical which is going to be launched today. So with this, I will stop here. Otherwise, I'll keep on talking and you'll kick me out, because this is I feel that in my lifetime, if I can make a small contribution to optimizing stroke care in my country, I feel I'm blessed to have been born in India. So thank you. And now I invite Dr. Vishnu. Please come and a summary of what you have developed and what this Smart India is about.
Good evening, everyone. So as Madam has told, today is we are celebrating the World Stroke Week, and the mandate of the World Stroke Day and the World Stroke Week this year is precious time and save every minute to save millions of neurons. So problem which we faced around in India and around the world, especially in India and the low-middle income countries, is the access to expertise. Whether we have neurologists all over the country to guide treatment at that point of time when there's a precious window period is there or not. So initially there was two models which has been discussed in the academic circle and in the policy side. One is the stroke physician model. That means you empower the physicians in the district hospitals to manage stroke. The same physician who manages heart attacks, the snake bite, the poisoning, sometimes deliveries, everything he manages, he empower him also to manage stroke also, to empower him, and you would give him a short training program and or periodic upgrade in his training. So that's one model. It is something different from the stroke physician models that in the Western countries follow, where it is purely a vascular neurologist program. It is not different from that. This has been tried sometimes in China also. There is a stroke physicians, the general physicians, you give some training to the stroke. That was one program, one model which has been proposed. The other model, which was the telestroke model. So we got this idea from what Dr. Padma had done previously in Himachal about using WhatsApp in the remote areas of Himachal, connecting the district hospitals to the one or two neurologists. Only two neurologists were available in Himachal at that point of time. So she could show that with a simple WhatsApp, technology, which is this one, and she could make a difference in access to stroke care, in taking a decision making in thrombolysis. However, how much ever training that you give to a physician to ask them to thrombolyze a stroke patient in a remote area without somebody giving a go ahead, sometimes it was very difficult to do it. So that she could prove it in Himachal, and that which was successfully taken up in other states like in UP, Punjab, Haryana, where they were going on. So what we did was to take a little forward beyond WhatsApp. So we made a low-cost telestroke system, which is not the fashionable, the high-end telestroke that we see in probably in the Western setup, which we have everything live seeing at that point of time. So this is a very similar. I mean, it's an app where the physician can enter the data of the acute stroke patient coming, which are very minimal, which is an important data, and simultaneously it goes a notification to the predefined neurologist. He takes up the call. They can chat inside the app. They can send informations together. They can communicate. They can send images, CT images, and then they can finally take a decision, mutually decide on the management of the patient. Yeah, literally, he can handhold the physician in taking a stroke management. Then once he takes a decision, then again we provide, and inside this system itself, we provide an opportunity for the physician to have access to a tele-rehab system, where they can have access to a tele-rehab, our project tele-rehab people who will provide the tele-rehab support. So this was the system which we had planned, and we have made the app. So it has been pilot tested. It has been tested in all the major nodal centers, where you can see it's in the PGI, in IMHANS, IGMC, in Kangra, GMC Goa, and Andhra Medical College. We have been pilot tested in all the nodal centers where the neurologists there will be hand-holding the district hospitals, which has been given below, right from Leh Ladakh to district hospitals in Agra, Rai Bareilly, the Khaneri in Ram Kanpur, Solan, Hamirpur, Ambala, Panchkula, and in the south Goa, North Goa, and the 2 district hospitals in Karnataka. So we have done a workshop, which we have done the basic training for all the physicians in all the district hospitals. So now we are going ahead with the trial, which we compare with these two models. We hope that whatever comes out of it, whether the low-cost telestrokes comes better or the stroke physician model comes better, both are important for the policymakers to take a decision how to go forward, how to empower these district hospitals. And this will make we strongly believe that this will make a difference in stroke management in our resource-limited settings. Thank you.
Next, I'd like to call Professor Rohit Bhatia to introduce his project, please.
Thank you, Ayush. Dignitaries on the dais, faculty colleagues, students, and research colleagues as well. As has been already alluded to, what comes to our mind when we look at stroke from a larger perspective across the country is that it is never going to be an homogeneous care. What we provide at a tertiary level at All India Institute of Medical Sciences or PGI Chandigarh is not going to be at the level of district hospitals and medical colleges. So as Dr. Vishnu alluded to one vertical, the second vertical, which I've always been very passionate about myself and have felt that it drives a change, is the medical colleges. Sitting in a busy OPD, we always feel, or in the ER, that why couldn't this particular patient be treated locally in his own city or in a state where there are big medical colleges? And that brought us to a thought process over the last 2.5 years, and the thinking went on that why don't we improvise stroke care and look at what is actually happening? So this IMPETUS, which stands for Implementation of a Uniform Stroke Care Pathway for Medical Colleges in India, is basically an implementation research. It's a difficult design because we need to understand the barriers and the facilitators at each site. But also we all know that education drives a change. And if we educate with a predefined module of every step, what do we do in the ER? What do we do in the inpatient care? What do we do to tell the patient that you're going to be discharged? What are his requirements at home? And what do we do on follow-up? This all is very heterogeneous. It may look very simple, but this is not even ideal even at the best of the institutes. So to drive this change, we thought of this particular project. This is going to be done at 22 medical colleges across the country. We have a predefined education module that we have developed at each step. They're going to be both components, a component of qualitative research where we do focus group discussions at each level in each medical college. And we come to what their barriers and facilitators are. And also a patient-based quantitative assessment, whether we could really improve patient outcomes by our educational initiative. The education spans 6 to 7 months of intensive teaching program at each college, which will be locally mentored by the collaborator. I must especially thank Indian Council of Medical Research for funding this project. I would definitely bring into perspective the support of Professor Padma and all my colleagues. I must mention that during the development of the protocol, and I have my colleague Dr. Partha from community medicine, who is also a co-principal investigator, who has also put in a lot of effort in designing this protocol by his input about community and requirements at the community level. And one of our ex-students who's now a faculty at Bikaner Medical College to give me insight as to what really happens when it's a ground level reality. We had to really go back and forth in even designing our case record form, designing our module, and designing everything to really understand what we all need to do at the level of a tertiary care institute, which is away from the real reality that we don't feel when we are at All India Institute of Medical Sciences. So thank you very much, and I hope that we would be able to drive some change, and we will be able to give the policymakers the real requirements which each person or each institute feels in the setting they are in. It may be different at each settings, but we really need to know, and this is probably one of the only implementation research which would have ever been done at the level of medical colleges to really understand their facilitators and barriers. Thank you very much.
Thank you, Rohit. Before we actually formally unveil the projects, I was asking, Amit, would you want to say a couple of lines about your CARE-DAT? You can speak from there.
Well, as ma'am has rightly pointed out, whatever we try best in stroke management, rehabilitation is an integral part of the stroke management long-term process. We have to accept that reality, whatever best we can do. And we are so fortunate that it's very difficult in research area to get the similar synergy minds together, then only a product can realize. And most of the failures I have seen that it is because of the non-synergy. But I'm so lucky that with ma'am, with IIT Delhi, with my student, with my old team, the idea was exactly the same. We want a product, low cost, in low resource settings to help patients at the ground level. And from head to toe, it's a big projects that we can do. But we started with something for the activity of daily living, for the movement of hand and wrist, so that patient can rehabilitate better for utilization of their wrist and fingers. And the alpha prototype was developed as a PhD product under co-supervision with ma'am. And that student is already here. She's a senior scientist with us now, Dr. Neha. And this is the beta prototype, which would be under phase 3 clinical trial to be done on like 250 to 300 patients under this center activity now in next 2 years. And we certainly hope that there will be a couple of more projects and products that will come out. We are just now initiated activity on AR/VR activities for rehabilitation of stroke recovery. So thank you very much, ma'am and directors, for your inputs to us.
Thank you so much, Dr. Amit. Now moving forwards, I would like to invite the dignitaries on the dais to please unveil the projects and release the plaques of all the projects that have just been discussed. Thank you so much. Now I'd like to request Dr. Amit Mehendiratta and Dr. Ram Gopal Rao, the Honorable Director of IIT New Delhi, to please launch the website that have been developed by them. So we played it at the back. Yeah.
Thank you, sir. So, in fact, originally we also had Professor Balram Bhargava, the Director General of ICMR, to be here, but currently he is in Geneva. So he is sent a video recorded message. Can we have that, please?
Good evening, everybody. It is my pleasure to wish everyone on this World Stroke Day, and the Department of Neurology, All India Institute of Medical Sciences, is celebrating the whole of next week as the Stroke Week. And they will be raising awareness about strokes. And you all know that stroke is one of the leading causes of death and disability. And it is preventable by treating the various risk factors, the most important ones being high blood pressure, diabetes, high cholesterol, obesity, use of alcohol, and smoking. So if we are able to control these risk factors and adopt a healthy lifestyle, then we would be able to prevent stroke, which is, again, as I mentioned, a very disabling condition. And I congratulate the Department of Neurology, All India Institute of Medical Sciences, for celebrating the entire week as World Stroke Week and creating awareness in the population at large, and also carrying out several scientific research projects which have been supported by different funding agencies, including the Indian Council of Medical Research. Thank you so much.
Thank you, sir. Now I'd like to call upon the Honorable Director of IIT New Delhi, Dr. Ram Gopal Rao, to please come and speak a few words.
So, good afternoon, Dr. Guleria, Dr. Padma, and all the dignitaries who are present here. In fact, I was here in this room maybe 2.5 years ago. I think if you remember, that time we had launched a joint IIT Delhi AIIMS collaborative project scheme. We called it FIRP, Multi-Institutional Faculty Interdisciplinary Kind of a program. And I think as a result of it, now I see at least 50 projects. That's what my colleagues tell me. close to 50 projects which are now ongoing between the two institutions. And many of these projects have also gone on to receive funding from external agencies. Initially, all these projects have been funded internally by IIT Delhi and AIIMS, and now all these investigators are going out and receiving funding from outside agencies, I think, which is a good sign. So now we have initiated at least or created a platform for the two institutions to, or the faculty and students from the two institutions to come together and work with each other. I think on the same lines, today we are launching this COE, as was told, Center for Advanced Research and Excellence in Disability and Assistive Technology. And it's a center of excellence created with funding from Indian Council for Medical Research. In fact, there is also going to be another major assistive technology project, which is approved by ICMR between IIT Delhi and AIIMS Delhi. And that is, I think, almost like 80 crore kind of an initiative. So that will be launched in December. So I think in assistive technologies now, the two institutions will have much deeper engagements and collaborations, I think, which is a good sign for the country. And I also would like to see more interactions. I think, as they say, the dil mange more. I think now that we are able to work with each other, I think we should do more. In fact, if you have seen, IIT Kharagpur has started a medical school. They are now starting from this year. They are actually admitting MBBS students. And IIT Kanpur is also thinking on the same lines. And whenever people ask me what is that IIT Delhi is doing in the medicine side, I said we are collaborating with AIIMS. I mean, for us to start another medical college while AIIMS is next door looks funny. So we don't want to be doing that. So I think our only best bet is to come closer to you and see if we can do more programs jointly. In fact, the last time again when I was here in AIIMS to meet with Dr. Guleria, we came up with a proposal to start a joint PhD program between AIIMS and IIT Delhi. When I say a joint PhD program, one certificate, two logos, and we will advertise it and admit students to the joint PhD program so that we can give one degree. And that should happen. And as everybody tells me, AIIMS is much more difficult for getting these things passed as compared to IIT. In IIT, we have just a board which is chaired by, sometimes if there is no chairman, I chair it and approve it. But in AIIMS, I think you have a more complicated process. But I think if we can do that, if all of you can push it, if we can start that joint PhD program between IIT Delhi and AIIMS next year, if we can admit the first batch of students next year, I think that will be a game changer for the country. I think the country's finest engineering institution, finest medical institution coming together and offering a joint PhD program, I think will set the trend for the country for others to follow. I hope we can do that. There will be a lot of normalization that needs to be done because our two programs are different. We understand that. But we have actually gone through that process with another university in Australia, University of Queensland. Between IIT Delhi and University of Queensland, we started the first ever joint PhD program from IIT Delhi. And that has been a grand success now. In fact, we will just 2.5 years, we will have almost 100 students now in the joint PhD program. And we are getting students who otherwise would have gone abroad. They wouldn't even join us. But because it's a IIT Delhi University of Queensland program, we call it UKIDAR. And so many of them are coming and joining us. I think similarly, if IIT Delhi and AIIMS starts such a joint PhD program, I think there will be many industries which will also be willing to fund us. I think we should have at least 300, 400 PhD students, working jointly between AIIMS and IIT Delhi and doing a PhD, because most of these areas, I think, will be a little bit long term in terms of, finding some good outcomes. I think a PhD is a good platform to work on between the two institutions. So I think I would like to see that happen. I would like to see when there are 300, 400 students working between the two institutes receiving such a joint degree. And I think it's time now, because even the new education policy talks about something similar. If you have to follow new education policy, we have to start an engineering school on the campus here. And similarly, we have to start a medical school on our campus. I think there is no need for us to be doing that. We should just do many more things together. I hope that will happen. Thank you very much. Thank you.
Thank you so much, sir, for your words and insights. Finally, I'd like to call upon our Honorable Director, Professor Randeep Guleria, to please say a few words.
Thank you. Good afternoon. Professor Gopal Rao, Director, IIT Delhi. Professor D.K. Sharma, our Medical Superintendent. Professor Padma Srivastav, who's, well, if I may use the Master of Ceremonies was, who's beloved as far as the Institute is concerned. Dr. Professor Mehendi Rata, my faculty colleagues, residents, researchers, students, ladies and gentlemen. First of all, sort of let me carry things forward from where Professor Gopal Rao left, and then we'll move. I'll just move on to the stroke part. I think there is a need for all of us to move out from our silos and start interacting, which has to be interdisciplinary, not only in departments, but within institutes or with institutes itself. And we've been trying to do that for the last few years with IIT Delhi, with IGIB, with THSTI, with University College London. Neurology department has now a very good collaboration with UCL London, and we are supporting projects with UCL London by giving intramural grants. Both UCL is giving their researchers money in pounds, and we are giving it in rupees, and trying to develop collaborative programs as far as UCL India collaboration is concerned. We're also looking at that with Deacon's University, and Deakin University in Australia is also very keen to have a joint PhD program, because they have one, I think, with IIT Madras, if I'm not mistaken. So they are trying to look at a similar proposal with us, but we would be very keen to have it with IIT Delhi. And we've had this brainstorming with Professor Gopal Rao a few months ago. And he's right, we have a lot of processes, if I put it that way. It goes to Dean's Committee, Staff Council, Academic Committee, then gets approved by the GB. So it's a long process. And sometimes I think for academic programs, especially now with changing times and the way science is moving, this is too much of red tapeism. If we feel that is required, we should move ahead and get it done. So maybe we should learn from what IIT is doing and try and see how we can change our, let's say, regulations so that that can be done. Because I think this is really needed. There is a lot of things that we need to do and learn from IIT also. How can we have startups? Why can't we also develop startups like IIT can do? Why can't we have entrepreneurships? Why can't our faculty who have such good research ideas collaborate with other institutes and become entrepreneurs and take their ideas to the industry and develop things which are cost effective and are needed in our country? It could be molecules, it could be point of care tests, it could be so many other things, rehabilitation. That type of assistive devices which are needed in our country, which could be useful for all types of care. It could be for people who have visual impairment, hearing impairment, mobility problems. So I think there is a need for us to really work aggressively to move out of our silos, have collaboration, and take that leap of faith that we can do all of this so that we can take products and help in better patient care. Our ultimate center point is that we should be able to provide better care for our patients. And to do that, we have to do this. We can't keep relying on things coming from outside and doing it. We have to do it on our own. So if we have to improve the quality of care, we have to accept technology, you work with it, adapt it to our needs, and not really sort of say that we'll change everything. There has to be a combination of technology with physical presence or physical needs, and then that will move forward. But a lot of that is being done in today's program, and that's why I'd like to congratulate the Department of Neurology for this whole stroke week that they're having and the multiple programs that they're organizing. But in my mind, this is probably the most important program that they're doing, because this is a launch of something which is truly a game changer. We are seeing a huge number of strokes. It is, as was mentioned, the ICMR data suggests 1.8 million per year. But the challenge is that it's a different pattern of strokes, much more in the younger age group, much more in people with a lower socioeconomic status, people who have less access to healthcare. And that leads to more, not only mortality or effect on quality of life, but a huge burden as far as the family or the caregivers is concerned. So we need to look at the whole picture in totality rather than just looking at morbidity and mortality. How does it really change the entire family structure if in a person who is of the lower socioeconomic status, one family member has disability because of a stroke, and therefore someone has to look after that person. It could be a young girl who is then out of school, out of education. So it has a huge impact as far as the fabric of a family is concerned. And that's why it's important for us to really look at what we can do, both in terms of prevention and treatment and early intervention as far as strokes are concerned. We've always talked of the changing paradigm. COVID changed that and made us realize that it's not only non-communicable diseases, it's also communicable diseases that we need to keep in mind. And we have a dual burden of disease. But in both this dual burden, stroke still plays an important role in non-communicable diseases. But even in COVID, stroke was one of the other issues that led to a problem because of the hypercoagulable state and the endothelitis that the virus causes. So it's important for us to keep in mind that that area of NCD versus communicable diseases is grey to some extent. But like I said, we need to look at the inequality in our society and see how we address it so that we provide care as far as stroke is concerned to the most needy and irrespective of socioeconomic status, irrespective of whether the person can afford it or not. And therefore, we have to look at the advances that have been made. And there have been major advances. From my time as a resident to what we are doing today, there is a huge paradigm shift in the management of stroke or management of many neurological disorders. At that point in time, bulk of patients who were admitted in neurology, Dr. Chopra used to be the HOD at that point in time in PGI, would be sent home on a B complex tablet. Things have changed so much since that time. And I think, therefore, we must really move ahead in providing all of that change to our population, whether it's awareness, whether it's prevention, whether it's triage, or whether it's treatment and rehabilitation. All of these are pillars that we need to move forward in terms of proper care. And that's where the department has to really look at, beyond its own institute, and look at how it can help the country. And that's why I think the acute stroke care program, which is using IT technology, is very, very important. But it has to be properly validated. I'm glad that you're looking at these two modules and trying to see which is better. But remember, as was already said, that the diagnosis and management of stroke will always be by a physician. You will not have enough neurologists to do that. The bulk of the times, it will have to be by a physician. And therefore, we have to develop strategies of how do we use technology to be able to reach out to the physician so that he is confident in managing stroke care as far as the first response is concerned and understand the importance of time. That is also what is the theme of the World Stroke Day this time, that time saves lives. So how do we really translate that into reality is something that we need to look at. The second part is, of course, training of medical colleges across the length and breadth of India on evidence-based stroke care. Intense program, many months. So I think it's going to be really educative, and I hope that you would give them some sort of a certificate to say that they have gone through the program. But I think you need to move ahead and really look at how can you do this in a module or a capsule for a district level hospital. Because a lot of stroke patients will come to a district level hospital or even lower down. So could you develop some sort of a module which has simulation, which is online, which is problem based, you could put some scans also, and then ask them to really go through that, have an MCQ at the end, and maybe give them a certificate also saying that they have gone through this module, so that you can say this is a physician who is trained to diagnose and manage stroke even at a district level. Because you will need to have people at a district level and rather than just at a medical college level to be able to manage the burden of stroke that we have in our country. So I think if one can look at that, then that would be very useful.
And we have technology available. You can use simulations, you can put scans on board, you can make it a history based. So interactive modules could be made for doctors who can at least have it. But like you said, when you're talking to physicians, they have too many things on their mind. They're looking after diabetes, hypertension, stroke, COPD. So it has to be simple, and it has to be sort of something that they are comfortable with. So feedback is very, very important. We made a module for the WHO and for the Ministry on chronic respiratory diseases. And in the end, we called people from primary health centers and got a feedback from them. Because sometimes all of us sitting in a tertiary care hospital really don't realize the ground realities. So that, I think, is very, very important. And the third part, which is basically with IIT, which is looking at post-stroke disability, is very, very important. And it's good that we are trying to be innovative and develop our own strategies. And as was already mentioned by Professor Ram Gopal Rao, we are already very aggressively involved in forming a center of excellence as far as assistive technology and assistive devices are concerned. IIT Delhi, many other institutes are involved where we're trying to get cost-effective devices made. That center will be housed in the upcoming National Center for Aging, and that will be funded by ICMR with support from with the IIT Delhi to develop assistive devices not only from the neurology point of view, but across the board. It's not only neurology, it could be orthopedics, it could be ENT, it could be ophthalmology, or it could be even from cardiology point of view. So that is something that we need to look at. But we have a huge challenge because we need to look at infrastructure. What is the infrastructure that we have? How can we properly use it? It's a big challenge as far as stroke management is concerned. Trained manpower, I've already said we need to work on that. And the inequity or the, let's say, imbalances that exist between urban and rural India. A lot of these modules work very well in urban India, but in rural India, it becomes a big challenge. So how do we really translate that so that we are able to reach out to the last mile is very, very important. But I'm sure with the enthusiasm that the department has and the work that they're doing under the leadership of Professor Padma, you will be able to sort of reach all of that. These are sort of game changers, and I wish you all the best, but I'm also wanting that you really implement it so that it's not only like an ICMR project, but it becomes part of a national movement, and it's done beyond the project as something which is part of a national program. So I wish you all the best and congratulations to all the three groups. Thank you.
Thank you so much, sir, for your kind and encouraging words. Last but not least, I'd like to call Dr. Deepti Vibha for the vote of thanks.
Good evening, everyone. It is an honor for me to provide the vote of thanks on behalf of the Department of Neurology under the able leadership of Professor Padma. And I would like to thank Professor Randeep Guleria for providing his feedback and guidance on the 3 programs that we just launched. I would like to thank Professor Balram Bhargava, who joined us virtually and has supported these 3 programs wholeheartedly. I would like to thank my collaborators from IIT, Professor Ram Gopal Rao and Dr. Amit Mehendiratta, for coming all the way here and providing their presence and blessings. At the same time, I would also like to thank the other dignitaries who've joined us from other departments, Professor Senthil, Professor Vadhwa, our medical superintendent, Dr. D.K. Sharma, Dr. Aarti Vij, who has always been with us, my colleagues from the Department of Physiotherapy, my colleagues from my own department, and my young residents and researchers. Thank you all for being here and providing the impetus to this program. So now you all can join us for high tea. Thank you.